Let's get to our next discussion immediately. No fewer than 1.9 million persons are living with the Human Immuno Deficiency Virus, commonly known as HIV/AIDS, or HIV as it is. This is according to the National Agency for the Control of AIDS. In order to reduce the spread of this virus and treat persons who are with it, an HIV Trust Fund led by a private sector worth 62 billion naira has been launched in Abuja. President Muhammadu Buhari says the HIV Trust Fund is one way towards targeting the elimination of mother-to-child transmission of the virus by the year 2030. Kemi Balogun has the story.
Nigeria has a funding gap of about $108 million annually. This is due to years of depletion in donor funding, but as resources deplete, HIV infections still continue. In the past few years, the concern was to find a sustainable way of domestically funding the HIV and AIDS response in Nigeria.
Our shared goal to end AIDS in Nigeria.
This idea has now resulted in the birth and launch of the HIV Trust Fund of Nigeria.
We have continued to make good our commitment of placing more people living with HIV on treatment annually using national resources. However, strong domestic resources mobilization with an enduring partnership and shared responsibility is required to sustain the response to HIV and other emerging public health emergencies.
Government in itself is conscripted in terms of funds, and we must release these funds for basic social amenities and ask the private sector to step in and take its rightful place in driving the course of development in this nation.
Our national coverage of prevention of mother-to-child transmission is less than 50%, leading to about 22,000 cases of new mother-to-child transmission of HIV every year in the country.
1 out of every 7 children born with HIV in the world is a Nigerian, making the country account for the highest number of HIV new infections among children globally. For mothers like Hadiza Ibrahim, this initiative is a welcome relief to the HIV response for mothers and their unborn babies.
I know my status. I have had 5 children, 5 babies, and they are all healthy, they are all well, they are all doing fine, and they are HIV negative. Our babies deserve to live alive.
The private sector-led trust fund will be key to helping Nigeria achieve the UNAIDS 95-95-95 strategy of ending the AIDS epidemic by 2030.
All right, let's get into it now. Joining me via Zoom is Dr. Jeku Ozoemene, CEO, HIV Trust Fund of Nigeria. And also on Zoom is Dr. Ime Okon, Secretary, Nigeria Medical Association, Lagos State. Doctors, it's good to have you both join me on TVC Breakfast this morning.
Hi, good morning.
Morning. Great. Now, let me start with you, Dr. Ozoemene. It's a good thing, Nigerians hearing of the HIV Trust Fund. A lot of people were happy about this. But talk to us basically, how is this going to combat the mother-to-child transmission of HIV directly?
Okay, basically, and thank you for having me. Good morning, listeners. Basically, what we found out is that whilst Nigeria has done pretty well in some other thematic spaces in the fight against HIV, mother-to-child transmission has remained a challenge. Program funding has been a problem, but it goes beyond program funding. Because you see, one of the ways to determine, the easiest way to determine the pregnant women who are HIV positive is by getting all pregnant women tested, right? Irrespective of where they are accessing care, whether it's in a hospital, whether it's through a traditional birth attendant, get 100% of the pregnant women tested. But that requires a significant amount of resources. There's a cost to the testing, there's a cost to testing their spouses, because when you do that, you have to test the pregnant women, you have to test their spouses, you have to test the post-birth, you have to test the newborn child. If the pregnant woman is found positive, you have to put on antiretroviral therapy. After birth, if the child is HIV positive, right, or negative, you need to give the child some prophylactic treatment. So there's a significant cost to it, and the yield in terms of what is the funding that's applied vis-a-vis the number of people who test positive is low. So a lot of people, program people who fund such programs are reluctant to expand that amount of money to just get a few number of HIV positive cases. But for us as a country, it's tantamount to, I always use this football analogy, right? It's tantamount to a football team that's playing so well in his attack and the goalpost is open, because we can't identify all the people who are HIV positive, place them on antiretroviral therapy, while every year you have about 22,000 children being born HIV positive. So that alone stands the chance of totally eroding all the gains we've made over the last 2 decades. So that's why prevention of mother-to-child transmission is imperative. It's something we must do. We've realized that the public sector, government can't fund it because government has its own fiscal challenges. So government approached the private sector and asked us what we could do to support. And then we felt that within the private sector, we have certain competencies that are not exactly available to government. And I'm not just talking about just funding, and then of course funding. So we put together this trust fund. We've identified the areas where the funding is required to support the prevention of mother-to-child transmission. We will work with subject matter experts. For instance, I'm not a medical doctor. So when you welcome doctors, I suspected that the medical doctors will say, okay, who is this fellow? Who is this intruder? My doctorate degree is a DBA in banking and finance. So I'm a finance specialist. So that's the skill I'm bringing to the table for this venture. So what we will do is we'll bring together the subject matter experts who advise us on how best to allocate the resources and put an end to prevent or eradicate mother-to-child transmission in Nigeria.
All right. Well, the point there is you're a doctor, whether you're not a medical doctor, but you are a doctor. So, well, we thank you for what you're doing. Now, let me come to you, Dr. Okun. We noticed in the early 2000s, in the late 1990s, and then the early 2000s, there was a massive campaign against HIV at that time, and everyone felt the impact of it. And then, gradually over the years, we saw how that, campaigns dwindled. Do we see this now as a revival of that campaign for people to get aware and more understanding and get more enlightenment regarding the issues of HIV and how to prevent it?
Yeah, thank you once again and good morning. Thank you for having me. So like you rightly observed, in the early parts when we had, at that early 2000, we had a lot of donor funding. And that is not sustainable. Like between 2005 till now, we have a record that about $6.2 billion has been spent on the HIV response in Nigeria. And about 80% of that has been coming from donors. There's what we call PEPFAR, that's the United States President's Emergency We're
losing your voice, your sound from your end, Dr. Okun. Okay, well, we hope to have her back on. Let me come back to you, Dr. Ozemene. The point there is the idea now of using antiretroviral drugs to, handle issues of.
Global Fund.
Oh, okay. We have
about
her back.
80% has been coming.
Go ahead. We lost your voice at the time, but you're back on now, so go ahead, Dr. Okun. All right. Dr. Okun, we lost your voice at the time, but you're back on now. Let's hear you. Go ahead.
Okay. All right. So I was saying that it is not sustainable having outsiders fund this. So domesticating mobilization of resources to using our private sector. You know, like when you see how the private sector responded, they formed a coalition and it's really helped us. So this looks more like what is sustainable. And prevention of mother to child, low-hanging fruit for us, because when you have people already living with HIV/AIDS and they are adults, the best you can do is manage. But you know, when you catch a woman because you can even start management when the person comes for ANC, for antenatal care, you test for HIV. If the person is HIV positive, you start giving drugs, you monitor the viral load and all that. We've had almost like 100% success. Most times, once you go through that route, the child is not coming out positive. So we can have a generation, a future generation, HIV free. So it's like a low-hanging fruit for us. The target is well targeted. And this looks like something that is more sustainable. We are having donor fatigue. So we have to take responsibility and own this HIV response ourselves. So it's a welcome development.
Okay. All right. Dr. Zambenen, let me come to you on this. The idea now, the new concept of looking at the possibility of using antiretroviral drugs for COVID-19, how would that put pressure on the care for HIV for whom antiretroviral drugs were originally made for?
Okay, so I'm not sure which I mean, I'm not a medical doctor, you know, I stated that I issued that disclaimer upfront. So I'm not sure whether it's the same antiretroviral therapy that will be applied to COVID-19 patients. But what is important for me, and I think Dr. Kohn referenced it earlier, is that because a significant portion of the HIV intervention in Nigeria has been funded by donors, right? And there's existing donor fatigue. In fact, we're actually a victim of our own success in terms of the fight against HIV. Because from 2001, right, to 2020, the prevalence rate in Nigeria has dropped from about 5.8% to about 1.3%. So donors are saying two things. First of all, we've done this thing for over 2 decades. We have supported you about $500 million every year since 2001. We need to begin to focus a bit more on countries that have a higher prevalence rate. We also believe that you are in a position as a country, largest GDP in Africa, etc., to fund more of your own interventions. And then two, there's a new kid on the block, which is COVID-19. So COVID-19 has started attracting more of those resources that are typically available to the HIV/AIDS intervention. And, you know, when Dr. Okon said earlier that, when you mentioned the fact that earlier that in the 90s and early 2000s, that there was a lot of publicity around HIV, etc. I believe that part of the reason why we've not heard so much about HIV again is because of the success of antiretroviral therapy and then the fact that somebody has been paying for it, right? So when so it's not if, when the donor agencies say, okay guys, it's time to wrap up, we are scaling down or we're reducing our funding by say 50%, right? And we have to address other healthcare challenges, etc. Then these 1.6 million people who are placed on antiretroviral therapy, a lot of them may no longer be able to afford that therapy. And if they are no longer able to afford that therapy, their viral loads will spike. They will become open to the opportunistic infections that the viral load suppression has protected them from. and we'll have another serious healthcare issue challenge on our hands. So from that perspective, one, COVID-19 is drawing away resources. Two, donor agencies are signaling that it's time for them to leave. So we have to, as a country, as a people, step forward, right, and bridge this gap. Unfortunately, that donor fatigue is not just for the international donor community, it's also for the Nigerian private sector, because there are several interventions, whether it's COVID, whether it's infrastructure, whether it's police and defense, that have been set up recently where the private sector has stepped forward and contributed significant amounts of money, right? And remember, these organizations, you mentioned earlier, they have their CSR, they're also taxpayers, and then they're increasingly playing this role. So beyond the corporate organizations, we are also going to look at the average Nigerian on the streets, right? To say, guys, we have a burning platform moment. The reason why you're not aware of it is because the communication has largely remained within the medical community and of course the donor community. The medical community is aware of how much has been put in place to ensure that our people living with HIV have achieved viral load suppression significantly. And of course, we no longer have those challenges around opportunistic infections, etc.
All right.
However, if this stops, then we have a crisis.
Okay.
So we're actually looking at a crisis.
All right, I'll come to you shortly. We're trying to manage time. Dr. Okon, let me come to you on this and talk about the issue of discrimination. Now, relatively or comparatively, there has been a little more awareness compared to the late or the early 90s, as it were. How has this awareness reduced discrimination against people living with HIV?
Yeah, so in the early parts, just like when you're just getting a knowledge about something, everybody knows that HIV is a transmissible disease. So there was that worry that, how do I get it? Is it just by sitting beside someone, sharing spoons and all that? So we have been able to, demystify and correct the errors about modes of transmission of HIV. There's been a lot of awareness creation, and that is why you can find people living with HIV, many more of them through their support groups have been able to come out in public to speak about their status. So the stigma is significantly reduced this time around. I think around 2010 to 2015, the theme was like a 5-year theme that we talked about getting to zero discrimination, zero AIDS-related deaths, and zero, I think, maternal to child transmission. So of all these zeros, I say again that this trust fund is going to significantly help us with that maternal to child transmission. There are so many countries that have been able to eliminate this. And, in small spots here in Nigeria, because I'm an HIV site coordinator, I remember one facility where I was working for like close to 3 years. All the mothers that came to that hospital that were HIV positive and were receiving their antiretroviral, I was always proud to say that we had 100% success, as in none of them had an HIV positive child. So this is something that is quite achievable. And like you asked the question, the discrimination is reducing drastically. People are getting to know that you can't just get it by touching people and all that. And they see the strategies in place. We are making success. So the discrimination is reducing.
Okay, that's encouraging. And we look forward to this trust fund coming up right now. We'll also add up to the success so far. Thank you very much, Dr. Emil Kun, for joining us on the program. And let me also thank you. And let me also thank Dr. Jeku Ozoemene for talking to us on the breakfast program. We certainly will have you again for other aspects of this so people can get to understand more. We need to talk about issues of partners and how to sustain the trust fund and all of that. Thank you so much for coming on the program. Dr.
Ezoemena, our associate member, Nigerian Medical Association.
Really interesting. It sounds really great. Thank you very much. Thank you. Thank you.